Hello, I am Kevin Moorehead, and I am a patient of Franciscan Health. I live in Indianapolis and lived here pretty much all my life. On April 10th, I tested positive for COVID-19, and I was admitted to Franciscan Health in the emergency room.
Hi, I'm Colleen. I brought him to the hospital, and when I left him, I had no idea how long it would be that I would never see him again.
I was in there 36 days. 15 of it was under the ventilator. Several days being in what I call the dark rooms, where they were pressurized rooms, because I did have a collapsed lung. I remember bits and pieces. Doctor told me that I may never remember. My brain will not allow me to remember because of the shock. I don't remember a sentence 15 minutes ago. I do remember someone in there saying that he's waking up, but there was a lady that was holding my hand, and with her other hand she kept telling me that I was going to be okay, because she really eased me going through that particular part. After I got released from the intensive care unit, I did go to therapy. They moved me to the 6th floor in the therapy part. They evaluated me for physical therapy, occupational therapy, and speech therapy.
Well, before he actually got moved out of the dark rooms, or he was still in the ICU or the step-down unit, the ladies that do the Zoom calls, I can't tell you how wonderful that felt. Even though the first time we did a Zoom call, he was still on the ventilator, and the nurse that day actually showed us the ventilator and what all the tubes were for. Was, even though it was scary, was very, very comforting, because we got to actually see him.
When I worked with Kevin, at first, again, I think I was still learning him. I was also still learning COVID. I tried to reassure him that, listen, this is new for me. I'm going to do whatever I can with my knowledge and my skills to help you the best I can, but we're just going to focus on what are you having difficulty with and what do you need to do at home and what can I help you with to get there. Franciscan Health offers a fantastic continuum of care. By the time they get to my unit, the Adult Inpatient Rehab Unit, we do further assessing. At that point, they are considered COVID negative, ruled out by 2 tests, and we can finally try to work on getting them home. So we're doing cognitive testing. I run them through a battery of tasks just to see where they're at. Their goal is to get home, and many of them are trying to get back to work, because as much as this is affecting an elderly population, it's also affecting our younger generation as well. The cognitive testing is to check, again, the memory function, their ability to problem solve and sequence, and on our unit we're asking them to do more things. They're up with physical therapy, walking the hallways, using new equipment. They may also be up with occupational therapy, doing exercises in the gym, working with our kitchen, or even at the laundry. And that's where sometimes we see these breakdowns.
Right now, the speech therapy is doing memory work, because I do have very bad issues with my memory.
I have the wonderful ability to actually get a really close relationship with my patients, because I work with them a 5 out of 7 day window. And every day, Kevin, for example, he was stuck with me for an hour a day. I'd show up. The schedule varied depending on when PT needed to come in. OT, nursing is primary in this recovery as well. But I work with them daily. And again, out of a 7 day window, we leave them exercises and things to do even on the days that we're not there. My priority was, I knew he was working full-time prior. I knew he was independent at home, and his wife was working as well. And so I really honed in on learning what he did prior, what was his job's duties, what was his daily routine, and then I focused in on the cognition. At first, I think he was a little bit apprehensive, because we were asking him to do a lot of things he just hadn't done yet during his medical stay, which is understandable. He was pretty medically unstable. And we worked on memory. We also worked on alternating attention. So having something maybe in the background that he had to focus on while working on a paper task. We also worked on what we call dual tasking. Maybe in physical therapy, I would tell them, okay, while he's walking, have him do cognitive things. Have him count backwards by sevens, have him, name animals, something where he's walking and using his mental abilities as well. I think it was by the 4th day that I do feel like I had his confidence a little bit more. I think he realized that, wow, this is a real thing. I really am experiencing these problems. And after that, I just feel like he kind of took off. He was more confident about what he was doing. He had a better understanding at some of the tasks that I was bringing in and why. And I think it's when we finally scheduled his discharge date too. He finally had that light at the end of the tunnel. It was rewarding to see him turn around because he was in a dark place for a while, which I know he probably spoke about, but he turned around pretty quickly for us.
Yeah, I've been out of the hospital about 10 weeks now, and she says I'm doing great.
The good news is, he's alive. He's gonna get back to normal as much as we can get him to get back to normal. Other people haven't been as fortunate as we have.
Yeah.
We're thankful for the hospital here.
Everybody involved needs to be recognized, and from housekeeping to the doctors and nurses, everyone involved in every step of my time in the hospital. Every one of those people I would like to thank personally from day one, from the time I walked in, and especially when I walked out and all those people were lined up. And when I got released, it was like one of the greatest feelings that you could have is people that knew your story, that the word was through the hospital of how one person had, beat the odds. And the odds were stacked against me. And if it wasn't for Franciscan Hospital, I don't think I would be here. I think if I went to another hospital, I wouldn't have been alive. I really believe that.